Inclisiran is another injectable therapy, and again it's a targeted mechanism. It affects the process in terms of the numbers of scoops, if you like, that are receptors that are removing cholesterol from the blood. But rather than inhibiting a protein that affects this process, it actually works on a more molecular level, and before that protein's even made into a protein, it inhibits that being formed. So it's a very specific, again, targeted way of reducing cholesterol. Inclisiran comes as a subcutaneous injection, which is administered by a healthcare professional rather than being self-injected, which the PCSK9s are. Now, the flip side to that is, rather than a 2-weekly injection, which is the PCSK9s, Inclisiran is a less frequent injection. So initially you would have an injection, and then 3 months later you'd have another one, and then it's a 6-month cycle essentially, twice a year once you're stable on the medication. Inclisiran can be prescribed by anyone in terms of a medical practitioner. It is not restricted to secondary care. So I think there is obviously logistics around how we do that and the capacity, but I think there's a recognition that there's a large cohort of patients who would benefit from Inclisiran, who from a single secondary care clinic may not have the capacity to do that, I expect, in terms of the numbers of patients who may benefit out there. Inclisiran is different. The eligibility criteria for that is a lower threshold with, again, a single event and then intolerance to oral medication or unable to achieve a target with oral medication, and the LDL is lower to above 2.6 is the threshold to consider that. So for patients who have had a single event before, whose LDL cholesterol is above 4 millimoles per litre, and they again have had multiple statin use or unable to tolerate a dose of statin that lowers their cholesterol sufficiently, they will be eligible for the PCSK9 inhibitor. If those patients have had 2 events, so that's maybe 2 heart attacks or a heart attack and stroke, they would have to have an LDL above 3.5, it's slightly lower. There is a separate group of patients, those with familial hypercholesterolemia, who may not have had a heart attack or stroke before, and this is those patients who've been diagnosed with familial hypercholesterolemia. They would be eligible for the PCSK9 inhibitors should their cholesterol show an LDL above 5 millimoles per litre. So on Inclisiran, it is really only in England those patients who have had an event, a vascular event, who are eligible.